Case number 4 is a young female patient with soft tissue swelling and a mass at the left ankle. Ultrasound was performed, which shows a large, aggressive appearing heterogeneous soft tissue mass along the posterior medial aspect of the ankle. We can see it eroding into the adjacent tibia here, and then we see these thin echogenic or hyperechoic lines here. This is the blown out cortex as the mass expands out from the bone. The mass has areas of cystic degeneration in it. We see it partially encasing the posterior tibial tendon with fluid in the posterior tibial tendon sheath. We also see it partially encasing the flexor digitorum longus tendon. As we come out, we see the neurovascular bundle being displaced out by the mass over here. Color Doppler assessment was performed, and we can see that there's significant internal vascularity within this mass. We see areas of cystic degeneration, and again that blown out thin cortex on the periphery of the lesion. Radiography was performed on the same day as the ultrasound, and we see this lytic lesion in the distal left tibia. It extends all the way to the articular surface. It is eccentric in position, and we do not see a sclerotic margin, so it does not have a Lodwick 1A margin, and we note that the growth plates are closed. That invokes a differential diagnosis, although the constellation of findings are suggestive of a giant cell tumor of bone. We do see this blown out, thinned cortex corresponding to the echogenic lines that we saw on the ultrasound. An MRI was also performed. This is an axial proton density fat suppressed series, and you can see this hyper-intense soft tissue mass, which is basically coming from and eroding the tibia here, which is what we saw in ultrasound. We see a thin hypo-intense line that's running around portions of the mass, and that corresponds to the blown out and thinned cortex. We see the posterior tibial tendon with fluid in its sheath, corresponding to what we saw on the ultrasound. The partial and, in some places, almost completely encased flexor digitorum longus with the neurovascular bundle and FHL displaced posteriorly. This coronal proton density fat suppressed series shows basically the same findings as the X-ray. We see this large intraosseous mass extending out medially, blowing out the cortex and thinning it. Again, we see this hypo-intense linear area corresponding to what's left of the cortex. We see areas of cystic degeneration, and the mass does extend down to the articular surface. The growth plate is closed. So again, these findings were most suggestive of giant cell tumor of bone, and biopsy did confirm that diagnosis.